Welcome to People. I'm Micah Mater. Let's get started. With variants gaining strength and vaccines on the decline, COVID-19 appears to be rebounding. Just this week, the American Academy of Pediatrics announced new guidelines as schools prepare to welcome students back in the classroom within weeks. They say everyone should be wearing masks, students and adults, regardless of staff vaccination status. So with the CDC reporting cases across the country up 55% in the last week, are we going forward or backwards in the effort to get back to life as we knew it? Well, Dr. Michael McGee from Premier Health Network is joining us with the latest COVID headlines. Doctor, thank you so much.
How you doing? Thank you.
I'm good. Okay. There's so much going on. I just saw on one of the networks talking about Nevada is being hit really hard, another surge. They're talking about shutting down parts of Europe. There are places here in Chicago we can't travel, Louisiana being one of them. What is going on?
Well, I mean, it's just like with anything. If you have a bunch of people who are not doing what they need to do, viruses tend to get into your system and they grow and they mutate. And that's what has happened. We went from COVID-19 to now this Delta variant, which first started in October of 2020, and we saw the devastation it did in India. And so it was at that time more virulent than COVID-19, probably about 50 to 60 times more virulent, and also very easily spread. And we were hoping that it wouldn't jump across the international waters and come to the US, but obviously it did. And so it's here now. And at one point we thought it wouldn't get to us. And now, as we've gone full blast over the summer, we're starting to see it pop up everywhere.
We know how dangerous it is for unvaccinated people. What about for vaccinated people?
Well, I mean, as you already knew, the vaccines were about 95% effective. So 5% of the population are still at risk. And the reality is this particular virus has a heavy viral load. And so it's like a lot more potent than the previous COVID-19. And so typically, the COVID-19 has been devastated by the vaccine and it has been doing its job. But now it's almost a whole different type of virus. And so we don't know what's going to happen with the vaccine after 6 to 9 months. There's a chance we may need a booster. Right now, the CDC is not saying we need to do that. But there's a chance further down the line as these things keep going from Delta to now Lambda. As you know, the Lambda variant is now in Houston. So this is scary.
Was the CDC premature in saying no masks?
Yeah, I think they were. I think they were. If they were going to do that, they should have made it so that you would have to show your card or show something that showed a record showing that you got vaccinated. Because you got a whole bunch of perpetrators out here who are claiming to be vaccinated, including anti-vaxxers, who actually may have gotten vaccinated, but yet want to spread a lot of misinformation and myths about it.
Well, we know that school is about to start, and we know that several districts here in Chicago are going back and forth, actually having arguments. Parents are having arguments. Should it be, optional? Should it be mandatory? I mean, how do we deal with this as we start going back to school? Will we see another surge?
Oh, we already seen another surge, right? We've seen it already. So since last week, we have 23,000 more pediatric cases. Last week, it was half of that. So we're already surging. We're not even back in school yet. And so, as you all know, kids do have chronic problems. There are plenty of kids out there who have hypertension, diabetes, obesity, asthma, which are major risk factors, which is why we saw a huge disproportion of Black people dying last year because of their chronic diseases. There are plenty of kids out there like that. And also, there are some kids who may have some long-term effects from the long hauler syndrome. 1/3 of people who get COVID may not even have any symptoms, but yet 2-3 months later, they're starting to have these long hauler symptoms. And so we don't know what it's going to entail for our youth. So the recommendation from the pediatric, organizations are saying they all should be wearing their masks. And if it was my kid, I would definitely have that. And as you already know, there have been well-documented cases where kids who didn't have any long-term effects of chronic diseases have died.
When do you think that the immunizations will be able to go to the younger kids?
Well, they say it in December. Right now, we're still trying to get kids from 12 to 18 their vaccination. Right. The country the statistics are showing that only 28% of kids 12 to 18 or 12 to 15 have gotten their vaccinations. And so we have a lot of work to do. And we need to have everybody, every organization out here saying, let's get this vaccination, guys. Let's do what we need to do to save our kids.
Let's talk about the controversy surrounding the Johnson & Johnson vaccine. First of all, it caused some type of heart disease. Then they say kids are having problems with it. Now they're saying you may need a booster regarding the Johnson & Johnson. When do you think the CDC may come out with some specifics about Johnson & Johnson?
I mean, the reality is you don't really know a lot about any of the vaccines. Most of the damage that would occur will occur when you first get it, which is going to be allergic reactions, which are easily treatable. And so work is still being done on these. And so it's kind of, I can't speak for the CDC and when these things are going to happen. But I do know that some of the things that we have heard were very minimum. We had, 6 to 9 people who had problems with the Johnson & Johnson originally. But it's, out of the number who are getting it, it's a low risk. If you compare to the risk of dying or having chronic disease from COVID, the benefits far outweigh the risks. And
Pfizer's another one that they had talked about for a while, although the CDC didn't say it. But a lot of people, the government and some other people are saying the Pfizer, we need a booster for the Pfizer as well. And there's so many different things coming back and forth from the government, from the CDC. It's hard to figure out what we should be listening to.
Well, I mean, it's just like we just said. If the Pfizer vaccine has done its job, it was effective in treating COVID-19. Now we have a whole different type of virus. And so when that happens, you may need to go back and get a booster. But right now, CDC is not saying you need it right now, but they're looking at all of that. And there's a chance you may have to do that. But the people who got the vaccine from the first time who didn't have any issues, I can't really see them having an issue with getting a booster if it's going to make a difference. I got my vaccine back in the end of December. And by September, October, I may need another booster. Who knows? But right now, they're not saying we need it.
And you do have a back-to-school immunization and vaccination that's going on today at 10 o'clock. We want folks to come out there. Bring your kids, right?
Yeah, so it's from 10 a.m. to 2 p.m. It's at our CSO multiplex. And what we're doing is a little atypical. You guys know they've been having big vaccination drives, and only 50 to 100 people have been coming. And so we decided to do a little bit differently and make it more innovative. So we partnered with a plethora of different organizations, including 100 Black Men of Chicago, Black Nurses Association, Cook County Physicians Association, Blue Cross Blue Shield, Chicago Department of Health, the Urban League, Church of God in Christ in Northern Illinois jurisdiction, and even youth organizations like This Is Life Chicago. And so what we're trying to do is have all these different organizations invite their network, which they have confidence in. Mm-hmm. So if these organizations are getting these invites from organizations that they already have confidence in, they're more likely to come. And so we're hoping that we can have a really nice turnout.
Dr. McGee, let's hope so. Be safe, be well. Thank you so much.